Welcome to The Explainer. Today, we're diving into something really fascinating. We're unpacking a crucial distinction between a biological reality and a linguistic label. Specifically, we're looking at albinism versus the term albino. You know, language totally shapes our world, but sometimes our everyday vocabulary kind of falls behind scientific accuracy and, honestly, modern respect. So, let's break down the genetics, the history, and why a slight shift in how we speak makes an absolutely massive difference.
So what exactly is the difference between albinism and albino? At first glance, you might think, well, aren't they just interchangeable variations of the exact same word? Actually, no way. They represent entirely different concepts. One is a concrete medical diagnosis, while the other is a historical descriptive noun. It's a super common linguistic trap, so let's go ahead and untangle it together.
All right, let's jump right into Section 1, the biology and understanding the genetic state.
To start, albinism is fundamentally a medical and genetic condition. It's characterized by an inherited deficiency that affects pigmentation. Now, that word inherited is the absolute anchor here. It means it's a genetic state that's literally hardwired into biology from birth. And interestingly, it doesn't just affect humans. It affects vertebrates across the entire animal kingdom.
To really wrap our heads around that genetic deficiency, we have to talk about melanin. This is the chemical pigment responsible for providing color to your skin, your hair, and your eyes. While pretty much everyone's body produces melanin, the genetic condition of albinism directly disrupts the biological processes that create it. It's basically like a roadblock in the body's pigment factory.
Because of that genetic block in melanin production, we see some very specific characteristics. The body's inability to produce enough melanin leads directly to a noticeable lack, or at least a major reduction of color, and that's what results in the distinct pale or colorless appearance in the skin, hair, and eyes. It's just a direct cause and effect at the chemical level.
Moving right along to Section 2, the terminology. We're going to look at the condition versus the label. Here is where we really need to draw a hard, clear line. On one side, we have albinism, which is the medical diagnosis and the genetic state. On the other side, we have albino, the descriptive noun, and, frankly, a historical label. Think about it. One is a condition you have, right? The other is a label used to describe what a person is. Using that noun historically takes a medical diagnosis and turns it into the entirety of an individual's identity, which definitely isn't the whole picture.
And that brings us to Section 3, person-first language and finding respect in communication.
You might have noticed that modern communication is seeing a really significant shift toward person-first language. And listen, this is definitely not about policing grammar. It's actually a fundamental evolution in how we show respect to one another. When we use labels that define someone entirely by a medical diagnosis, we kind of obscure their broader humanity. Person-first language corrects that. It literally puts the human being before the genetic condition.
Because of that, the phrase person with albinism is currently the standard respectful wording you'll see in modern care. It completely acknowledges the medical reality, but it firmly establishes that the individual is a person first and foremost. Sure, they have a genetic condition affecting their melanin, but they absolutely aren't defined entirely by it.
So, I want to leave you with this to chew on. How does the terminology you choose impact the identity and respect of the people around you? We've seen today how a shift from a historical noun to person-first language isn't just a matter of semantics. It's actually a profound demonstration of empathy. Keep this in mind the next time you encounter medical terminology in everyday life. Language matters, for sure. Let's choose our words intentionally.